Welcome to the Adaptive Physical Education National Standards webinar. This webinar has been developed by Maryland's Adaptive Physical Education Consortium, also known as MAPAC. The Adaptive Physical Education National Standards were developed by the National Consortium for Physical Education for Individuals with Disabilities. Currently, the president of this organization is Dr. Susanna Dillon. The APENS chair is currently Dr. Tim Davis. There are currently over 1,500 national certified adaptive physical education teachers in the United States. This webinar will take between 30 and 40 minutes. Let's begin. The eligibility requirements. There are 3 eligibility requirements to sit for the exam. You need a minimum of 12 semester hours, a minimum of 200 documented experience hours, and a valid teaching certificate. The MSDE online course credits in adaptive physical education will count towards the 12 credits to sit for the exam. The 3 credits in adaptive physical education during your undergrad program will also count towards the 12 credits. To find out more information, visit APENS website, www.apens.org. Complete Part 1 of the application and make a check out for $150 payable to APENS. When and if you pass, complete Part 2 of the application. Then mail Part 2 to the address listed on the screen. Please refer any questions you have to the APENS chair, Dr. Tim Davis. His email is davist@cortland.edu. The exam consists of 100 multiple choice questions. You will have 3 hours to complete the exam. To prepare, it is recommended that you purchase the Adaptive Physical Education National Standards 2nd edition book for $33. This can be purchased through PE Central or Human Kinetics. The Adaptive Physical Education National Standards Study Guide for $28 can be purchased by going to the APENS website. The next exam in Maryland will occur at the Maryland Alliance for Health, Physical Education, Recreation, and Dance, also known as Mayford Convention, located at the Hunt Valley Inn on October 17, 2014. It will be in the Chase Room on the lower level between the hours of 10 a.m. and 1 p.m. There are 15 national adaptive physical education standards. We will review each standard individually and then provide 1 to 2 sample questions for each standard. Standard 1 looks at human development and has a strong emphasis on taking content knowledge and applying it into a classroom practical setting. The standard is divided into the following 7 subcategories. It is recommended to direct your study to those aspects of human development that influence to a large extent the challenges some individuals with disabilities face in acquiring physical education skills. These range from complexity of game symbols and interactions used in play, such as expressive and receptive language, the outcomes of engaging in activity with others, and numerous other factors, some beyond the individual's control, that influence successful outcomes. Take a moment to answer the sample question for Standard 1. The answer is A. The best answer is size of the ball because it is a modification of the equipment. The other answers impact the environment. Prader-Willi syndrome impacts the human growth and development of a child. It is a genetic disorder that causes life-threatening obesity in children. Individuals with this syndrome often have low muscle tone, short stature, and motor development delays with some behavior concerns. Standard 2 looks at motor behavior. This refers to how individuals develop. The standard requires the knowledge of typical physical and motor development, as well as understanding the influence of developmental delays on these processes. Adaptive physical educators should understand motor development, motor learning, and motor control. Here is Standard 2 sample question. While in an instructional situation that requires attending to several stimuli, individuals with disabilities benefit from pre-cueing that has the effects of. The best answer here is C, reducing choice reaction time. Pre-cueing as a technique helps an individual who has problems with choice reaction time to select from among several possible choices, thereby reducing the amount of time it takes to actually respond to a specific stimuli. Standard 3 looks at exercise science. Adaptive physical educators must understand that modifications to the scientific principles of exercise and the application of these principles may be needed when teaching individuals with disabilities to ensure all children benefit from exercise. Combine your knowledge of human anatomy and modifications of an equipment to gain practical insight into the efficiency of your students' movements. We will now look at a sample question. Individuals with achondroplasia often have flexion contractures that inhibit full elbow extensions. Therefore, activities that involve weight bearing on the hands may be inhibited by elbow flexion contractures. The best answer is D. Standard 4, measurement and evaluation. Understanding the measurement of motor performance, to a large extent, is based on good grasp of motor development and the acquisition of motor skills, covered in all standards. You should have a good foundation in measurement of motor performance before proceeding with measuring the ability of students with disabilities. Adaptive physical educators must have a knowledge base in measurement and evaluation to comply with the mandates of legislation and how it impacts the IEP process. We will now take a look at a sample question. The appropriate age at which a child should be able to walk at a rudimentary level is about. The best answer is B. Although some children begin walking at 9 to 10 months and others at 14 to 15 months, the majority of children, 90%, begin walking around their first birthday. Standard 5 is looking at the history and philosophy. Major components of each law that relate to education and physical activity are emphasized in this standard. The standard also highlights a review of history and philosophy as they relate to special and general education. Understand the knowledge and terminology related to trends in education is important in this standard. You should know the general intent of the law and the specific implications of adapted and general physical education. You should also review educational reform in relation to individuals with disabilities in the United States. Lastly, you should be able to draw parallel between special education concepts and adaptive physical education concepts. Here's a sample question that we can look at. The answer is A. Posture training was a fundamental concept in medical gymnastics because it focuses on the specific development of body awareness and body control. B, C, and D are not correct because medical gymnastics did not use these as primary components. Let's take another look at another sample question for Standard 5. For this question, we are going to need to know what least restrictive environment means and the laws pertaining to least restrictive environment. The best answer is A. The least restrictive environment is the place where the students learn best and is appropriate to his or her educational needs. The teacher uses instructional strategies to address behaviors in the appropriate learning environment. The least restrictive environment does not refer to other students. Placement is decided based on needs by the educational team and is not driven by resources or funding. Standard 6 looks at the unique attributes of learners. Adaptive physical education must have a knowledge base of the 14 federally identified educational disability areas. Unique attributes are important factors, information that is utilized while planning and implementing the lesson, and the impact on physical activity. Review the disability categories listed in IDEA. Focus on the following unique attributes for each disability and its impact on the area of motor, cognitive, social, communication, health, medical, and behaviors. We will take a look at a sample question. For this sample question, you're going to need to know the terminology hypertonia. You're also going to need to know about traumatic brain injury. The best answer for this question is D. If somebody has hypertonia, also known as high muscle tone, they should be involved in slower, more static, and relaxing activities. An individual with traumatic brain injury should also avoid physical activities with high impact and quick jerking motions, such as jumping rope. This is why the A, B, and C are the most appropriate activities. Standard 7 is looking at curriculum theory and development. As you are planning to teach physical education to students with disabilities, you should recognize 5 components to curriculum theory and development. 1. Understanding the foundation of curriculum design, changes in educational trends, and the development of new curricular models in physical education. 2. Selecting content goals based on relevant and appropriate assessment to support goals for the overall curriculum. Structure the scope and sequence of the content, classify objectives, and analysis of skills and tasks for appropriate progressions. 3 is conducting learner analysis for the IEP process, including determining what assessment to use, conducting the assessment, using the data to make placement recommendations, planning the program activities, and writing goals and objectives for the student's IEP. 4 is looking at designing learning objectives, aligning with the underlying goal of the curriculum. And 5, planning learning experiences to support the achievement of objectives. Take a moment to look at this sample question for Standard 7. The best answer is A, the condition under which a particular behavior is going to occur. For example, whether the ball is pitched or sitting on a tee is one of the fundamental components of a well-written objective. Standard 8 looks at assessment. Assessment in relation to adaptive physical education goes beyond data gathering to include measurements for the purpose of making decisions about special services and program components for individuals with disabilities. Legislative issues. You should have a knowledge in federal and state mandates, the referral process, ethic issues of assessment, and the rights of the parents or guardians. Your knowledge of the terminology used throughout the screening, assessment, measurement, and evaluation process. These include formal and informal methods used. You will demonstrate your knowledge of the eligibility criteria, Individualized Education Program, IEP, and the present level of academic achievement and functional performance, previously known as the present level of performance or PLOP. Administration. This is your ability to conduct the assessment based on the protocol for the tool, your knowledge of the tool and ability to administer it to the students. Interpretation. Your ability to analyze and use the data results to identify needs, plan future instruction, communicate results to the IEP team, determine eligibility, and recommend service delivery options. Decision-making is your ability to drive future instruction using theory frameworks, ongoing assessment results, and available resources. Functioning as a member of the interdisciplinary team. You are a member of the educational IEP team. This includes reporting information to parents and guardians and other educational team members. Your ability to record assessment results for the use by the team, and your understanding of the interface between your results with those of other team members. It is important to remember that you are part of the educational team and you are not alone. It is a team effort. Take a moment to look at this next sample question for Standard 8, looking at percentiles. The best answer is C. When the student scores are converted to percentile ranks, it defines how well the student performed in comparison with the rest of the group on whom the test was normed. Percentile ranks are used to compare students to each other, not to compare students to the test. Standard 9 is looking at the instructional design and planning. This occurs prior to providing services to meet legal mandates, educational goals, and the unique needs of the individuals with disabilities. Human development, motor behavior, exercise science, and curriculum theory development are applied to this standard. Planning of the curriculum. You will need to understand the factors needed to develop a systematic overall curriculum plan of instruction and design units and the lesson plans to maximize instruction. The IEP and the IEP process. You will demonstrate your knowledge of federal mandates, such as designing and writing present level of academic achievement and functional performance statements, annual goals, short-term instructional objectives, and the initiation and duration of services. Your ability to know technology and the application included assistive technology and mobility devices. Your knowledge for utilization of communication boards, canes, crutches, walkers, wheelchairs, gait trainers, and other adapted equipment used to enhance the participation of individuals with disabilities in physical education and sports. Here's a sample for standard number 9. The answer here is D. The key element in the question is standing all day. Muscular endurance is the best answer, as this form of fitness is needed to perform the assembly line tasks that require standing for long periods of time. Standard 10 is looking at teaching. This standard encompasses other standard areas such as human development, motor behavior, and exercise science. Teaching styles. You will need to have the knowledge for the continuum of teaching styles, these strengths and weaknesses, and when to best apply each specific situation. Review the works of Muska Mauston and Sarah Ashworth to help guide you. Teaching behaviors. You will show your understanding for how the wide range of teaching behaviors are used to promote learning. The 8 teaching behaviors include instructional cues, task analysis, time on task, qualitative and quantitative skill learning, lesson pacing, communicating learner expectations, social climate, and knowledge of results. Review the works of Judith Rink to help guide you. Applied behavior analysis. You will show your understanding how to utilize strategies to manage appropriate and inappropriate behaviors in the classroom by using token awards, communication devices, behavior charts, and positive reinforcement. We will take a look at a sample question for Standard 10. The best answer here is D. Reducing transitions is the only strategy that is specific to preventive behavior management. Creating your routines helps, as well as knowing how you are going to transition from one lesson segment to the next. Being proactive and pre-planning the lesson is key to this situation. Standard 11 looks at consultation and staff development. When working with other service providers, it is essential to have knowledge of the dynamics of advocacy groups and basic consulting models. Utilizing active listening and knowledge of administrative hierarchy and program organizations are important to addressing the standard. For more in-depth information, you can research Maslow's theories of consultation and staff development online. Remember, this is a team effort, and you are not alone. You want to work with your educational team members. Here's a sample question to look at for Standard 11. The key to this question is looking at the first step. The best answer is C. Identifying what a student needs to learn and when they should master the material is of primary importance. Understanding how curriculum decisions are made for teaching individuals with disabilities. For assistance with this and other questions, review the text entitled Development, the Physical Education Curriculum, an Achievement-Based Approach, written by Dr. Luke Kelly in 2004. Standard 12 looks at program evaluation. Components of the standard consist of student outcomes, program operations, and consumer satisfaction. Certified Adaptive Physical Education candidates should be familiar with the Physical Education National Curriculum Standards, published by the NASB in 1995, and the new national standards published by Shape America in 2014. The new standards can be found at shapeamerica.org. Here's a question that we can look at for Standard 12. The best answer is C. The teacher has the responsibility to assure that parents are kept informed of the child's progress. Choices A and B make good sense, but are not good practice than a fundamental right under the law. Children are not reliable reporters of their progress as indicated in choice D. Standard 13 is looking at continuing education. The slide lists 5 components of continuing education. Opportunities for professional development are available through coursework at a university, workshops, seminars, and presentations at conventions. Distant learning is also an option. Stay current by reading Palestra, Jopard, Strategies, or other professional journals. Stay current with technology advances in the field. Here's a question for Standard 13. The best answer is D. The Director of Special Education should be able to provide assistance. The other answers, A, B, and C, may not be the best depending on your state. Many states no longer have a state supervisor for health and physical education. The state superintendent and their immediate staff may not know about adaptive physical education and would only direct you to other staff. Standard 14 is looking at ethics. This slide lists the 4 major components of ethics. Appropriate conduct also includes continued professional development, serving on committees, and accepting leadership roles as appropriate. We will now look at a sample question for Standard 14. The best answer here is D. The correct answer identifies the 3 critical elements in the credentialing process: education, knowledge, and experience. Most of the other answers introduce important considerations, but are not as comprehensive as that offered by choice D. And our last standard is Standard 15, communication. The adaptive physical educator should understand the importance of family support and be an advocate for families by being knowledgeable of organizations and community programs that can assist families. Effectively communicating the importance of physical activity for individuals with disabilities is part of public relations. Communicating effectively with other professionals and understanding their job roles is part of the team approach for adaptive physical educators. Let's take a look at our last question. An example of collaboration between occupational therapists and adaptive physical educators related to common goals on a student IEP is. The best answer is C. Both adaptive physical educators and occupational therapists could collaborate to assist a student to dress for physical education class. Choice A falls under the job description exclusively of the adaptive physical educator. Choice B requires collaboration between the adaptive physical educators and physical therapists. Choice D requires collaboration between adaptive physical educators and therapeutic recreation specialists. To understand this question, the candidates must know the roles and responsibilities of other service providers and professionals. When 2 professionals work together to combine to make one goal, this is known as an embedded goal. We have completed reviewing the 15 national standards. with sample questions. If you have any questions, you can contact one of these 5 people. They can guide you in locating resources or with specific content questions. Thank you for participating in our Adapted Physical Education National Standards webinar. I have enjoyed this time being able to be your host. Remember, if you have any questions, you can contact Dr. Tim Davis by emailing him davist@cortland.edu or contacting the individuals on this slide. I wish you the best of luck as you go forth in taking the exam and becoming one of the over 1,500 nationally certified adaptive physical education teachers.